Hi, everyone. I'm Bianca Palmisano. I'm the owner of Intimate Health Consulting, and this is the Sex Advent Calendar, 25 days of sex education all through the month of December. So today I wanted to talk a little bit about having discussions with your doctor. I think that this is an issue that a lot of people struggle with, where they feel like they need to have conversations with a medical professional about their sexual health and about questions that they have or unusual symptoms that they're experiencing. But there's a lot of difficulty bringing those conversations up and fear that your medical professional won't be able to handle them appropriately. And I'm not going to lie, there are definitely folks out there in the medical profession who are not ready to have these conversations with you. But you do, as an individual who is experiencing a problem, deserve to have those answers. And the only way you can do that is by starting a conversation with your provider. And if they can't help you, getting a referral to someone who can. This is something that I work on extensively with my company, Intimate Health Consulting, and I'm happy to have further conversations with anyone that has questions. But I just wanted to give you some general tips about how to approach these conversations when you do so for the first time. I always recommend that people bring notes if they have something specific that they want to talk with a doctor about. You generally only get 15 minutes with your provider in the room, the rest of the time just being getting your vital signs from a nurse or a medical assistant. And so if you have a bunch of points that you want to remember to bring up, and especially if you have a variety of symptoms that you're experiencing, it can be super helpful to just have it all laid out in a little document on your phone or a note card that you bring into the office with you so you don't forget anything. If you're already going in to get an STI test or a pap smear or pelvic exam, that's a really great time to bring up any sexual health issues that you've been experiencing, because you've already sort of set the tone for that conversation with the content of the rest of your exam. And if you're not getting tested regularly for STIs, I highly recommend that become part of your general health practice. So what kinds of things might you bring up with a healthcare provider about your sexual health? The most obvious one is pain. So if you're having pain either during sex or just in your genital area, those are really important things to mention to a provider. It could be signs of an STI. It could be signs of a psychological issue that you're having around sex, because we grow up in a society with a lot of baggage about sexual encounters. Or it could be a more complicated problem that you would need to see a pelvic floor therapist, a urologist, or another specialist about. If you're having issues with your libido, that's also worth talking about. A lot of times those are environmental and stress-related problems, and so a referral to a therapist could be really helpful, but sometimes they are related to medications that you're on or to other physical health problems that you have. And of course, if you're having problems with lubrication or with your erections, those are also worth bringing up, particularly with erections, because erection difficulty can be a sign of early stage heart disease. Fun fact, Viagra was actually developed as a medication for people with heart disease and was later found to be very powerful as an erectile dysfunction drug. My last suggestion to you is just to remember that your mental health and your emotional experiences are also really important and worth bringing up with your provider. So if you are a person who's experienced intimate partner violence, if you have experienced a sexual assault or another form of trauma, those are all things that are worth talking about with your provider, because your psychological health can have vast impacts on your physical health as well. And it can be really important to talk about how those things interplay. Likewise, if you're a person that experiences depression, if you've been having suicidal thoughts, or or if you have any other mental health issues, those are also important to bring up. I just want to remind people that you are not alone in those struggles. There are so many individuals who have their own difficulties with mental health, and there's a big thriving community of people talking about this. And some of our later discussions in the Sex Advent calendar will be specifically around sex and mental health. So I hope that you'll tune in for that. I hope that these quick tips were useful for you and that you feel confident to try having a conversation about your sexual health with your doctor the next time you go to an appointment. Thanks so much, and definitely stay tuned for other sexual health videos throughout the rest of December.